it's nice to meet you too, Leslie. Dach, thank you for joining me here in Dallas, Texas to talk about Medicare open enrollment. Let me tell you, I mean, everything is centered around this, I guess from October to December. Tell me, first of all, when are the open enrollment dates, and then we'll talk about the high drug prices for families.
Yeah. Well, open enrollment opened on October 15th. It ends on December 7th. And during that time, 65 million seniors will be making choices about their health care for 2024.
All right, that's good, because I've got 9.7 million of those seniors who listen to the Valder Beebe Show on various platforms. Let's talk to them about high drug prices their families are probably experiencing, which is a shame. But can you tell us about the impact of rising prescription drug prices on seniors?
I hope that most of your listeners don't experience what I'm about to describe, but I bet a number do. You know, we know from studies that large numbers of seniors can't afford the drugs they need to stay alive, so they skip doses or they cut their pills in half. They're choosing between filling their refrigerator and filling their prescription, all the while the drug companies just rake in egregious profits. So that's got to stop. And this Medicare year, people will begin to see cost savings thanks to the Inflation Reduction Act that was signed by the president in the fall of last year.
Thank you so very much, Mr. Biden. How does the Inflation Reduction Act really benefit us this coming year? Because my seniors are telling me they're so inundated with signing up, but they're not hearing a lot about the Inflation Reduction Act from those people who want them to sign up for these plans.
Yeah, you know, that's unfortunately true. You know, not many people really know about this. To them, it seems like some gobbledygook government bill that doesn't make a difference in their lives. But this one really does. It's going to make them healthier and give them some economic peace of mind. So many of the good news is that if you sign up for Medicare, you get these benefits. You don't have to check any special box. They come with your Medicare and your drug plan. So that's good news. Some of the benefits are already in place, but here are the major ones. If you're a diabetic on insulin, your insulin is now capped at $35 a month. Many seniors were paying hundreds of dollars a month. Essential vaccines like shingles were hundreds of dollars. They're now free, along with other essential vaccines. Drug companies have the ability, and often do, raise their prices far higher than inflation just because they can. Now they're going to pay a penalty if they do that, and people will see a rebate for some of that money. And finally, but critically, this is the first year where Medicare has the power to negotiate with drug companies to lower prices. And that's going to make a big difference a few years down the road when those prices come down. And then in 2025, feels a bit away, but it's really important to know, is that your out-of-pocket drug costs for all the drugs you take, if you're a senior, will be capped at $2,000 a year. Many seniors are paying high multiples of that, particularly if they have chronic diseases like cancer. So this will make a difference in people's lives, and it will make a difference in their health and in their peace of mind.
This is so exciting. I don't know if you've ever gone to the pharmacy and they say insurance is not covering it. Let me tell you, after you faint, then you're very, very irritated that, you know, that's the price of the drug. I want my audience to know that Leslie Dach, he's the founder and chair of Protect Our Care. Now, Leslie has served in the Obama administration as a senior counselor to the Secretary of Department of Health and Human Services and as the department's global Ebola coordinator. Leslie, you've got quite a resume behind you, so you come well qualified to talk about what my audience needs to know. So what can be further done to protect our patients and help us?
Even more importantly, I'm on Medicare myself, so I know this firsthand. You know, at first, I do want to remind people that you get these benefits when you sign up, so take advantage of them. If you did walk out the door of the pharmacy when you heard how much your shingles vaccine costs, go back. It's now free. If you were cutting doses of insulin, know that that the cost is way down. This is going to help not only you, but also it's going to give peace of mind to your kids who take care of you and your other relatives. We do have work to do to protect these because there are a lot of members of Congress who voted against this at the beginning. and they want to take it away. So it's important that people understand how important this is to their constituents. And also, we need to extend these benefits, frankly, so that others who have their insurance in other ways or who are uninsured also get these benefits. So those of us in Washington have a lot to do. My advice to the people listening is just know your benefits, take full advantage of them.
Listen, I've got to ask you a question. It seems like those who are purveyors of these plans that support Medicare, they're calling them Advantage plans, different kinds of plans, they're coming off real friendly this year. They're saying, oh, yes, we'll send you to the gym. We'll let you get ear devices. They're saying a lot of things. What changed? Is that the Inflation Reduction Act is making them different?
No, that's not. That's, kind of marketing in a sense. And I think as, one of the fundamental questions that Medicare beneficiaries need to answer is, do they want to stay on traditional Medicare? Or do they want to move to Medicare Advantage? There are pluses and minuses to Medicare Advantage. Yes, you might get some of these benefits, but there's also typically a very narrow network of physicians that you can see for your care. And also there's far heavier requirements for prior authorization before you go to the specialist. So, what sounds so perfectly good may not be perfectly good for you.
This is eye-opening. Leslie, I really appreciate it. Once again, where does my audience go and become more informed? But just say they want Washington to know their opinion. How do they do that?
Yep. So also, if you're on Medicare and you have questions about it, go to the Medicare website. It's actually quite good. It's simple. It's medicare.gov. Medicare also has really a good call center. I've used it a lot of times. One of the best I've ever, as a consumer, have ever used. So please get your questions answered. They're there. They are indeed there to help you. If you want to know more about how to protect these benefits, please go to our website, protectourcare.org. And if you see your member of Congress, tell them what you think.
I think that's great advice all around. I want to thank you for stopping by the Valder Beebe Show. My goal is to help empower those people called baby boomers, because we're the biggest generation. Well, those millennials kind of overtook us, but we're the second biggest generation on the planet, and I think we have power. Thank you, Leslie.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.